Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us on the program today. Our guest in studio is Dr. Lawrence Edwards, professor of medicine at the University of Florida, also a rheumatologist and chairman of the Gout and Uric Acid Education Society. And he's here in studio today with us to talk about the Go for 6 campaign, a campaign designed to raise awareness about the importance of knowing your serum uric acid level in order to combat gout. Good afternoon and welcome back to the program, Dr. Lawrence Edwards.
Thank you, Neal. It's a pleasure to be here again.
Thanks. Now, the Go for 6 campaign, talk about this campaign. Why is it called Go for 6?
Well, it's to emphasize the new guidelines that have come out over the past 5 years, both from the European Rheumatology Group as well as the American College of Rheumatology. But very central to the treatment of gout is lowering uric acid. Gout itself is caused by an accumulation of uric acid in the body, usually over years and decades. And the treatment of it in the long term is to get uric acid levels back down below the level where uric acid comes out of solution. So in most of us, our uric acids are low enough that uric acid stays dissolved in our blood without much problem. But once it gets over a certain number, then it actually can form precipitates, very similar to if you're adding too much sugar to your iced tea. It gets to a point that it just stops dissolving. Well, that's how people should think about uric acid in the body. The number that uric acid really starts coming out of solution is around 7 milligrams per deciliter. And so both the European and American rheumatology groups settled on a value of 6.0 milligrams per deciliter as being our target for therapy with uric acid lowering drugs. That way we're well below the solubility product and the uric acid can gradually start dissolving that's been deposited around the body.
Well, how does one get into a situation where the uric acid is above normal or acceptable or healthy levels?
Well, in truth, about 25% of the male population in this country now has an elevated serum uric acid level, at least elevated above 7.0 milligrams per deciliter. Genetics plays a huge role in this. Obesity certainly contributes, and some of the medications that people are commonly on these days, for instance, low-dose aspirin will raise uric acid levels. So there's a lot of push across the whole population for uric acid levels to become elevated. And then out of those that have elevated uric acids, about 1 in 5 will develop gout, and those tend to be the ones with the higher gout levels, usually up in the 8, 9, 10 and above range. So it's very the gout is very much a product of how high your uric acid is and how long it's been elevated like that.
In addition to the Go for 6 campaign, you recently conducted a survey. The Gout and Uric Acid Education Society conducted a survey that showed that only 29% of us correctly identified gout as a form of arthritis. Did you also discover whether or not diet played a role in reversing or preventing gout? Is this something that we just, are going to have to deal with, or if we begin a healthy diet, say, in your teens, is gout something that we don't have to worry about?
Right. Well, certainly watching your weight in your teens is a very helpful thing for minimizing your risk of getting gout. Diet itself has been greatly emphasized. In fact, if you go on the internet and look up gout, most of the websites are there about some sort of magic formulation or diet that's going to control this. That's not true. Diet itself doesn't cause gout, and you can't cure gout by dietary restrictions. You can lower your uric acid a little bit by eliminating some of the very high purine content foods. Purines are the substances that break down and form uric acid, and those include things like organ meats, liver and and sweetbread, kidneys, things that most of us don't eat a whole lot of. But then red meats and pork certainly are contributors. Shellfish and small fish like anchovies, those are very high in purines, and restricting those is a good idea. Not that, again, it's going to cure gout by itself, but that it's going to be helpful in preventing the ups and downs of your uric acid level in your blood that cause the flares of gout. Beer, of course, is always the one that's talked about most, and it is a fairly common trigger for gout flares.
You've got a website, gouteducation.org. When our visitors go to this website, what would we expect to find, especially when it comes to this Go for 6 campaign?
Well, we've been emphasizing this target of uric acid for a couple of years now. The Gout and Uric Acid Society has had their gout website at gouteducation.org now for 11 years. And we've emphasized different things over the years. We're really pushing the treat for target because we think this is the new approach that's going to be most helpful to get more patients well controlled with gout. In the past, and still in a lot of physicians' offices, they're on a treat to symptoms type of approach, so that if somebody comes in with a flare, they'll treat them with some corticosteroids or some nonsteroidal anti-inflammatory drugs or colchicine, the commonly used medications for the flare, but they won't approach the underlying problem, which is the elevated uric acid levels. So this is really a reach out. Our website was first and foremost a patient education site. We're trying to get the level of information out to patients and dispel some of the myths about this disease. But we also added a physician's side to the website, and we have videos on there of some gout experts discussing these various aspects, as well as updates on recent research papers that are out that we put on this website.
You know, we talked about misconceptions and things of that nature in another segment when you were here before, but talk a little bit about the mindset of the patient who either suspects that they may have gout or know that they have gout, but maybe don't want to talk about it. Is that something that you've seen in your experience?
That's actually very common. Gout is a genetic disease, so it's really quite common for people that develop these painful toes and ankles and knees to have known that their uncle, their father, their grandfather, somebody in their family had gout. And so they recognize it pretty readily. They don't need the physician to tell them that they've been afflicted by the disease that runs in the family. And it embarrasses them because there has been this mythology out there that the reason you have gout is that you're an overindulger in certain foods, beer, or too much to eat in general. And so they view it as a self-inflicted disease, which decreases the likelihood that they're going to come in and look for therapies because they're too busy kind of internally damning themselves for acquiring this disease. The truth is it's genetic, that very thin and healthy people get it. In fact, our spokesperson several years ago for the Gout Society was a former outstanding college and NBA basketball player, and was at the time the head coach of the Philadelphia 76ers, and was one of the most athletic people that you could imagine. And he was afflicted by it. So he recognized that there was this prejudice against gout, that there was too much of this self-condemnation for people that got it. And so he was our spokesman and really addressed this issue very well.
And at gouteducation.org, are there maybe some tips to help patients or physicians as well start that conversation to get treatment as quickly as possible?
Certainly are, and also the family members that we direct husbands and wives of people with gout to these, so that they're not part of the chorus of people heaping guilt upon the poor gout sufferers. So we go through the various mechanisms of how people acquire elevated uric acid levels, that the approaches are to get under good therapy and to get the uric acid levels down, again, to less than 6.0 milligrams per deciliter. And if they do that, the gout will, over time, resolve and become a big non-issue as long as they stay on their medications.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio talking with Dr. Lawrence Edwards, specialist in internal medicine and rheumatology, and serves as professor of medicine in the Division of Clinical Immunology at the University of Florida in Gainesville. He's also program director of the Medicine Residency Training Program and vice chairman of the Department of Medicine at the university. In addition, he's chairman and chief executive officer for the Gout and Uric Acid Education Society. And he's been with us in studio today talking about the Go for 6 initiative designed to raise awareness about the importance of all of us keeping our serum uric levels down. It's been great having you here with us today, Doctor.
It's been my pleasure, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.